1160. Dr. Gopala Ramineni is with us on the line this morning, the Hillman Cancer Center, operating at Indiana Regional Medical Center, as we talk about colon cancer here in Colon Cancer Awareness Month. And our conversation this morning is brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Dr. Ramineni, good morning.
Good morning, Todd. How are you?
Wonderful, and it's good to have you with us here this morning as we talk about a very serious subject that we've been speaking on here for a few days now. Colon cancer is something that is, as we say, very beatable, but so much more beatable if we catch it early. And so that's where every conversation about colon cancer seems to start, is early detection, right?
That's absolutely true. So, again, pleasure to be here a year later, a year older, none the wiser. And, again, a simple statistic, I hope, will drive down to people. If we diagnose people with stage 1 colon cancer, I'll say 90% of them will be alive at 5 years. And if we diagnose them in stage 4, 90% of the people will be dead in 5 years. So it just underpins the importance of diagnosing it early.
Has that statistic changed all that much in the last 5 or 10 years?
Well, I did skew the statistics by about 5%, but still, I mean, it's just as bad. Not really. I think I graduated in 2005. In 2005, stage 4 colon cancers, they lived about, 11% lived about 5 years, and now it's probably 15% living at 5 years. So the statistic has not changed. So what we can change is our behaviors. Cancer behavior has not changed. We can change our behaviors. And the one thing that is easily doable is screening. And unfortunately, still we fall short, meaning only about 70% of people that should be screened are getting screened. So we can reach, I hope this word reaches out to the 30% that are not getting the screening. And as you may have heard before, the screening age is lowered now because we're seeing colon cancer in younger people. So the screening age is 45, not even 50 anymore.
Yeah, and that makes such a big difference. And when we're talking about the age of 45, that's really a baseline, but then we talk about people who are more susceptible to it. There are different factors that will make somebody more susceptible to colon cancer or to the polyps in the colon that are the precursors to colon cancer. And so for those folks and those segments of the population, African Americans are one of those segments of the population. It's even more incumbent upon them to get their colon cancer screening.
Absolutely, Todd. It looks like you've become a pro with all these interviews. Wonderful. I mean, appreciate your insight there. Absolutely. Say, if there is a person who has a family member that had colon cancer diagnosed at the age of 40, the family member should start screening at the age of 30. Or the relative of that patient, first-degree relative of that patient, should start screening earlier by almost 10 years. So, this doesn't apply to everybody, but if anyone has family history of colon cancer at a young age, they should start screening even at a younger time.
All right. So when we talk about screening, we're talking basically about colonoscopy. That's the best approach, is it not?
That is the gold standard, correct.
Yeah. So we should get that scheduled and get that process rolling for us if colon cancer is discovered. And the symptoms of colon cancer can be varied. But if it is discovered, what are the treatment options, and particularly with you at Hillman?
So I always say if a cancer causes symptoms, unfortunately, it may be too late. So finding it before it causes symptoms is what screening is all about, And you asked about the treatments at Hillman. So we partnered with IRMC, and it's been a very great partnership. I'm blessed to be able to provide service to the community. I'm joined by Dr. Kamanova and Dr. Chitty, our radiation doctor. We have a fantastic facility here, and we have standard of care treatments. We have our surgery colleagues, Dr. Clark doing the robotic surgery, alongside with Dr. Billen, Dr. Godetti doing colon surgeries. Dr. Clark has been a pioneer in robotic surgery in our area, and in conjunction with that, we have the Hillman Cancer Center. We have the state-of-art radiation facilities, state-of-art PET scanners, and obviously we have state-of-art standard chemotherapy infusion center here in Indiana.
Now, you're a medical oncologist. You are also, though, a hematologist. And in the context of this conversation this morning having to deal with colon cancer, tell me about hematology.
Great. So I'm trained to be both an oncologist, cancer treatments, and hematologist. If anybody has blood conditions like anemia, which sometimes could be a symptom of colon cancer, early presenting symptom of colon cancer, I take care of those issues as well.
Yeah, hematology is certainly something that you pay attention to, and maybe we're not all that aware of it. But you mentioned a couple of moments ago about symptoms of colon cancer and how it can be present with no symptoms at all. And in fact, that's to our advantage if we are getting screened and we find that we have colon cancer but no symptoms, because it means we probably caught it in time, right?
That is correct. Usually, the right side colon cancers and younger patients have no symptoms. It spreads like wildfire. So that's why screening is so important. Left side colon cancers tend to cause symptoms earlier on, so we're a bit lucky there. So it's the right side colon cancers we hope to find with screening, Todd.
Yeah. Well, it is incumbent upon us all to get our colon cancer screening going. Men and women too. We don't isolate by the sex of the person involved. Colon cancer can strike all. Correct?
That is correct.
Yeah. All right, Dr. Ramineni, thanks so much. It's good to catch up with you again on what is a very, very serious topic on Colon Cancer Awareness Month. It's a very, very deadly cancer, but it's also very much beatable, curable. By early detection, and so it's incumbent upon us all to get that detection.
Absolutely. And one other point I just wanted to add is, we've got a lot of clinical trials that are available at Hillman, and people talk about immunotherapies all the time, and we have those immunotherapies that we're able to give to patients locally. Mm-hmm. And we do a lot of molecular testing on the colon cancers, and it is personalized medicine, if you will. We have all that available, and we have the wherewithals nowadays to even check for circulating cancer cells DNA in the blood and make treatment recommendations. And even skipping surgery for rectal cancers. I mean, those are things that are possible these days. So I think it's all possible, and we're moving the pendulum forward.
Absolutely, it's fascinating, and it's good news to follow as well as this all continues to develop. Dr. Ramineni, thanks so much for the visit this morning.
Thank you, Todd. Nice to be here.
Have a great day today.
Take care. Bye-bye.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.